You know, there's this, I guess you'd call it a cultural myth that we all kind of buy into as we get older. You picture turning 65, and right alongside all those AARP mailers, you get this one magical golden card in the mail.
Oh, yeah. The golden ticket.
Right. And it's like this ultimate all-access pass to just, free healthcare for the rest of your life. You just flash at the doctor's office, they nod, and everything is taken care of. No bills, no stress, just smooth sailing.
It is a really comforting thought. I mean, it sounds great, but the reality of that card is that it comes with strict deadlines, hidden penalties, and just a labyrinth of choices.
Yeah.
And if navigated poorly, it could literally cost you thousands of dollars a year. It is,
And it-
well, it's anything but a single simple pass.
Which is exactly why we are tearing apart this massive system today. Whether you are approaching 65 yourself, or maybe you're sitting at the kitchen table helping an aging parent sort through those towering stacks of mail.
Because there's a lot of mail.
So much mail. Or maybe you are just a curious learner who likes to understand how complex, high-stakes systems operate. Getting a grip on this before you actually need it is the ultimate life hack.
Totally.
So, our mission for this deep dive is to decode the Medicare alphabet soup, understand the hidden mechanics behind the choices you're forced to make, and, avoid those permanent financial landmines that catch so many people off guard.
I think the best place to start dismantling that golden card myth is by looking at the raw materials of the system.
Okay, lay it on us.
Well, Medicare isn't a monolith. It's this highly structured framework that's broken down into different parts, and each part has its own distinct rules, coverage areas, and most importantly, its own costs.
So let's unpack those letters. We've got Part A, Part B, and Part D. I've always found it super helpful to visualize this like a major hospital visit.
I like that analogy.
Right. So Part A is like the physical building itself. It covers your inpatient hospital care, maybe a stint in a skilled nursing facility if you meet some very specific criteria, and hospice and certain home health care services.
Exactly. And then there's Part B, which you can think of as the actual medical services operating inside and outside of that building.
The people, basically.
Yeah, the people. Part B is your medical insurance. It pays for the doctors treating you, outpatient services, lab work, preventive screenings, even things like durable medical equipment, wheelchairs or oxygen tanks.
Got it.
So if you are sitting on an exam table in a clinic for just a routine checkup, you are functioning within the world of Part B.
But why are they split up like that? I mean, it feels incredibly fragmented for a government program. Why not just have one big bucket for all medical care?
It really comes down to how healthcare was fundamentally billed back in the 1960s when the system was designed.
Oh, really?
Yeah, hospitals and doctors billed entirely separately back then, so the government just mirrored that structure. But what really trips people up today is the cost structure attached to these letters. The assumption is that, well, this is all free.
Right, because you've been paying Medicare taxes out of every paycheck your entire working life, so it should be free.
You have, but that primarily pre-funds Part A. If you or your spouse worked and paid those taxes for at least 10 years, you generally don't pay a monthly premium for Part A, but Part B is different.
Part B costs money.
Yes. Part B comes with a standard monthly premium, and it's actually tied to your income. If you earn over a certain threshold, the government tacks on a surcharge.
Of course they do.
Right. And on top of that, both Part A and Part B have deductibles you have to meet before coverage even kicks in. And Part B typically leaves you responsible for a 20% coinsurance on most services.
Okay, wait. I need to pause on that 20% because that is a terrifying number.
It is.
If I need like $1 million cancer treatment or a really complex heart surgery,
Yeah.
20% is $200,000.
Yep.
There's no way the average retiree can just absorb that.
And the craziest part is, under the original framework, there is no annual cap on that 20% out-of-pocket spending. The sky is literally the limit.
Wow. Okay, so that brings us to the third major letter, which is Part D. This is the prescription drug coverage. But unlike A and B, which are run directly by the federal government, Part D is a completely different animal, right?
Yeah, completely different. You have to go out and buy a Part D plan from a private, for-profit insurance company that Medicare has approved.
And they're all different.
Very different. Every single company has a different formulary.
Let's define that, because that's important.
The formulary is the absolute linchpin of Part D. It's basically the specific list of drugs that a particular plan agrees to cover. And they categorize these drugs into pricing tiers.
So a medication that is a cheap Tier 1 copay on one company's plan.
Could be a massively expensive Tier 3 coinsurance on another company's plan.
Exactly.
Okay, so we have our raw materials, the hospital building of Part A, the doctors of Part B, and the private drug plans of Part D. But you don't just walk into a government office and ask for one of each. Right, you actually have to choose a delivery mechanism for all this. You're basically standing at a massive fork in the road, and you have to pick a lane.
And the path you choose alters your entire experience with the healthcare system for the rest of your life.
It really does. So the first path is called Original Medicare. This is the traditional route. You enroll in the government-run Part A and Part B, and you purchase a standalone Part D plan for your prescriptions.
But what about that terrifying 20% uncapped liability we just talked about? Don't people on this path usually buy an additional policy?
They do. They buy a Medigap plan. That is the critical safety net for Path 1.
Medigap.
Yeah, Medigap or Medicare Supplement Insurance. It's sold by private companies to literally fill the gaps in Original Medicare.
Okay, so how does that work?
You pay a monthly premium for this Medigap policy, and in return, it steps in and pays that 20% coinsurance, the copays, and the deductibles that the government leaves behind.
I kind of want to use a car analogy here. Choosing Original Medicare plus a Medigap policy feels like buying a super reliable base model car.
Okay, I see where you're going.
Like you have to go out and separately buy a heavy-duty extended warranty to protect yourself from massive repair bills. But the huge advantage is that you can take that car to literally any mechanic in the entire country.
That is the defining feature of Original Medicare, yeah. Maximum geographic and provider flexibility.
So no networks.
Exactly. If a doctor or hospital anywhere in the United States accepts Medicare, they will accept your Original Medicare and your Medigap policy. You don't need a referral to see a specialist either.
Okay, so that's path 1, freedom, but higher upfront, predictable premiums. Then we have path 2, which is Medicare Advantage, also known as Part C.
Right. This is where you essentially hand over your Part A and Part B to a private insurance company, and they bundle it all together, usually throwing Part D in there as well.
But here's where I need to stop and ask the obvious question, because I see these TV commercials constantly.
Oh, the celebrity commercials?
Yes. Joe Namath or William Shatner looking into the camera, telling me I can get all my medical coverage, plus free dental, free vision, a gym membership, and maybe even a grocery allowance, all with a $0 monthly premium.
Yeah, they make it sound pretty incredible.
Right. Like, if I can get quote-unquote better Medicare for essentially nothing, what is the catch?
The catch is entirely in the funding mechanism and the loss of control. It is not better Medicare. It is a managed care system.
Managed care.
Right. The federal government pays these private advantage companies a flat per-person fee every single month to take on your health risk.
Oh, so if they don't spend all that money on my care.
If they manage your care efficiently, they keep the leftover money. That profit is what funds the dental cleanings and the gym memberships.
Ah, so they're highly incentivized to keep costs down on their end.
Precisely. And the mechanism they use to keep costs down is restriction. To use your car analogy, choosing Medicare Advantage is like leasing a fully loaded luxury vehicle.
The heated seats and everything.
Exactly. It comes with a great sound system and heated seats. Those are your dental and vision perks. But you are legally bound by the lease agreement to only ever take the car to the dealer's specific mechanic.
The provider network.
Yes. You must use the doctors and hospitals within the plan's network, which is usually localized to your specific county or state.
So if my favorite specialist isn't in network,
You pay substantially more, or the plan covers nothing at all. Furthermore, Advantage plans rely heavily on prior authorizations.
which means asking permission.
Right. If your doctor says you need an MRI, the insurance company has to approve it before you can get it. You're basically trading ultimate freedom for bundled convenience and perks.
Let's ground this in reality, because the contrast is really stark when you look at actual lifestyles. Imagine two people. Let's call them Susan and Tom. They're both turning 65.
Okay.
Susan is retired and spends half the year in Florida and the other half visiting her grandkids in Ohio. She also has a complicated medical history and wants to be able to fly to MD Anderson in Texas if she ever needs specialized cancer care.
Well, Susan requires the Original Medicare route. She pairs her Part A and B with a strong Medigap policy.
So she pays more upfront.
She pays higher premiums upfront every month, yeah, but her out-of-pocket costs are almost entirely eliminated. And she can walk into MD Anderson or any clinic in Ohio or Florida without asking an insurance company for permission.
Okay, then you have Tom. Tom is a total homebody. He lives in the same town he has lived in for 40 years. He uses the major health system right down the street for all his needs.
Tom sounds pretty low maintenance.
Very. He hates dealing with multiple bills. He wants one single plastic card in his wallet, and he really likes the idea of getting a few $100s a year toward his dental work.
Tom is the ideal candidate for Medicare Advantage. He is perfectly comfortable staying within his local network and accepting the plan's managed care rules in exchange for the convenience and those bundled extras.
And there is a massive structural rule we need to emphasize here for anyone listening. If you choose Tom's path, if you go with Medicare Advantage, you do not use a Medigap policy.
No, you legally cannot. Medigap is specifically engineered to pay the secondary costs of original Medicare. It does not interact with the private Advantage system at all. You have to choose one lane or the other.
Okay, let's say someone chooses the Advantage route because they love the perks. But a few years go by, they develop a serious illness, and suddenly those network restrictions and prior authorizations are just suffocating them.
It happens all the time.
They might think, this is awful, I'll just drop my Advantage plan, switch back to original Medicare, and buy a Medigap policy so I can go to any hospital I want.
But that brings us to the most dangerous mechanism in this entire system, which is the ticking clock.
Yes, timing is where the catastrophic financial mistakes happen.
It really starts with your very first interaction with the system, which is your initial enrollment period. For most people, this is a highly specific 7-month window tied to your 65th birthday.
7 months.
Right. It includes the 3 months before your birthday month, the month you turn 65, and the 3 months after.
So let's play devil's advocate. Let's say I'm 65. I'm in perfect health. I run marathons. I'm also still working at my corporate job. And I have excellent health insurance through my employer.
Good for you.
Thanks. I don't want to deal with the federal government yet. I'm just going to ignore Medicare entirely until I retire at 70. Is that okay?
Well, that decision hinges on one very technical detail, which is the size of your employer. The rules dictate that you can delay Medicare without consequence only if you have qualifying job-based coverage from an employer with 20 or more employees.
20 or more.
Yes, that creates a special enrollment period for you later. But if you work for a small business with 15 employees, or if you retire and go on COBRA...
Oh, COBRA doesn't count.
Usually no. COBRA or retiree health plans often do not count as primary qualifying coverage.
So if I guess wrong, and I assume my COBRA coverage protects me, what actually happens when I try to sign up at age 67?
You discover that you missed your window. You're forced to wait for the general enrollment period, which means you could go months without any health coverage at all.
That's terrifying.
It is, but the real punishment is the permanent late enrollment penalty. The government looks at how many months you were eligible for Part B but didn't sign up, and they assess a 10% penalty for every full 12-month period you delayed.
And let me guess, that is not a one-time fee.
No. That percentage is tacked onto your monthly Part B premium for the rest of your life.
For life.
Every single month, for as long as you have Medicare, you pay a penalty simply because you misunderstood the deadline rules years ago.
It is an incredibly unforgiving system. And the penalties don't stop with Part B, do they? The clock is also ticking on that Medigap policy we talked about earlier.
Yes, and this is the trap door for people who want to switch from Advantage to original Medicare later in life. When you turn 65 and enroll in Part B, a 6-month clock starts.
The Medigap open enrollment period.
Exactly. During these 6 months, you basically hold a golden ticket. You can buy any Medigap policy sold in your state, and the insurance companies are legally forbidden from looking at your medical history.
So even if I'm already sick,
they cannot deny you, and they cannot charge you a higher premium, even if you have stage 4 cancer.
but the moment month 7 arrives,
The golden ticket vanishes. From that point on, you are subject to medical underwriting.
meaning they look at your health.
Right. The insurance company can demand your medical records. If you have diabetes, a heart condition, or a history of serious illness, they can legally deny you a Medigap policy entirely or just charge you an astronomically high monthly premium.
Wow. Which means if you start in an Advantage plan, get sick at age 70, and decide you want the freedom of original Medicare with a Medigap safety net, you might be trapped.
You very well could be. You can switch back to original Medicare, sure, but you might be denied the Medigap policy, leaving you fully exposed to that uncapped 20% coinsurance we talked about.
Because your choices shrink dramatically the older and sicker you get, waiting to figure out Medigap until you actually need it is a gamble you will almost certainly lose.
Absolutely.
Deadlines clearly require precision. But aside from the ticking clock, relying on assumptions is the other great destroyer of retirement savings. People carry so many myths into this process.
They really do.
I want to run through the most dangerous ones. Myth number 1, the spouse assumption. I hear this constantly. My husband is a few years older than me. He just retired and sorted out his Medicare, so my coverage is just going to piggyback onto his plan.
That is a complete misunderstanding of the framework. Medicare is a radically individual system. There are no family plans.
No spousal umbrella at all.
None. A husband and wife have completely separate timelines based on their individual birth months. They have to navigate their own enrollment windows, and they can choose completely different paths. One might need an Advantage plan, while the other needs original Medicare.
Okay, myth number 2. The healthy person myth regarding prescriptions. Someone thinks, I'm 65, I take 0 medications, just a daily multivitamin. There is absolutely no logical reason for me to pay a monthly premium for a Part D drug plan right now.
And this circles right back to the penalty mechanism we discussed. The government requires you to have creditable drug coverage once you turn 65.
Even if you don't take any drugs.
Even then, if you decide to skip Part D because you don't need it today, Medicare keeps a running tally. When you are 72 and you suddenly develop a condition that requires expensive daily medication, you will finally sign up for Part D.
And the penalty hits.
Yeah, Medicare will hit you with a permanent, compounding penalty for every single month you went without coverage since you were 65. You essentially have to buy a baseline, cheap drug plan when you are healthy just to buy the right to avoid the penalty later.
So it's insurance against the penalty, not just insurance against the cost of the drugs.
Exactly.
Which brings us to the final and arguably most devastating myth. The "it covers everything" assumption. Specifically, the massive void surrounding long-term care.
This is a tough one.
The thought process is, I have Medicare, so if my health declines and I need to go into an assisted living facility, or I need a home health aide to help me bathe, dress, and eat, my healthcare coverage will step in and pick up the tab.
This is where families experience the most profound shock. Medicare is acute health insurance. It is designed to treat medical conditions, stabilize you, and send you home. It explicitly does not cover long-term custodial care.
Wait, really? So if someone develops Alzheimer's and requires a secure memory care facility for 5 years, Medicare pays nothing?
Absolutely nothing. Custodial care, which is help with the basic activities of daily living over months or years, is not considered medical care by the Medicare system.
That is wild.
They might pay for a very brief, limited stay in a skilled nursing facility if you are actively rehabilitating, say, after a knee replacement. But once you plateau and simply need daily assistance to live, Medicare stops paying.
So how do people actually survive that? Nursing homes can cost $10,000 a month.
They pay entirely out of pocket until they completely deplete their life savings.
Brain everything.
Yeah. Once their assets are essentially drained, they become impoverished enough to qualify for Medicaid, which is the joint federal and state program that actually does pay for long-term care for the indigent.
It is a grueling, exhausting reality for millions of families.
It really is.
That is a massive realization. Medicare is not a shield against the cost of aging. It is only a shield against the cost of medical treatment.
Which is why you have to treat your Medicare strategy with active vigilance. Are you treating this as a set it and forget it system? Because if you put your coverage on autopilot, you're leaving yourself incredibly vulnerable to the annual rug pull.
The annual open enrollment period every fall.
Correct. Every year, between October 15th and December 7th, the private companies running your Part D drug plans and your Medicare Advantage plans can rewrite the rules.
Just change them entirely.
Entirely. The formulary can change. A life-saving medication that costs you $20 a month this year might be completely dropped from the covered list next year. Your favorite doctor might get into a contract dispute and drop out of your Advantage plans network. The premium could double.
So a plan that perfectly fit your needs and budget in 2024 could be a complete financial disaster for you in 2025. You have to actively log in, check your drugs, joke your doctors, and review the plan every single year.
Active participation is the only way to protect yourself.
Let's synthesize all of this. Navigating the Medicare labyrinth comes down to a few foundational principles.
Right.
First, you have to understand the raw materials, knowing that Part A covers the hospital infrastructure, while Part B pays the medical professionals, and that neither of them are entirely free.
Exactly.
Second, you have to pick your delivery mechanism based on your actual lifestyle. You have to decide if you value the absolute freedom and predictable costs of original Medicare with a Medigap policy, or if you prefer the bundled convenience, localized networks, and lower upfront premiums of an Advantage plan.
And third, you must respect the ticking clock. Never guess when it comes to deadlines. The most expensive mistake you can make is assuming your current employer coverage or your good health exempts you from the rules.
It is all about moving through the system with purpose
Yeah.
rather than just defaulting into it. But as we close out, I want to leave you with a broader thought to ponder, something that steps outside the mechanics of the insurance itself.
That's an important question.
We established today that this massive trillion-dollar federal infrastructure, designed specifically to protect older Americans, explicitly abandons them when it comes to long-term custodial care.
Yeah.
If Medicare is intentionally not designed to handle the extended daily care that so many of us will inevitably need in our final decades, what exactly is the societal safety net for that rapidly growing crisis?
It's something we all have to face.
And looking inward, how early should we individually be planning for a catastrophic financial gap that exists completely outside the boundaries of our health insurance?
It forces us to realize that securing health insurance is just one small piece of a much larger aging puzzle.
It really does. It shatters the myth that turning 65 means getting a golden ticket that solves all your problems. You aren't being handed a solution. You are being handed a very complex tool, and it is entirely up to you to learn how to wield it. I encourage you to keep questioning the systems around you, review your own plans, help your parents review theirs, and as always, keep diving deep.